3 News Now Web Extra.
I wanted to ask you a few questions, obviously, about people getting back to the doctor and taking care of their heart health post-pandemic. We've been covering, of course, this surge with the Delta variant, and there's a lot of concern about that. Um, what are some trends that you've seen in the last year with people tending to their cardiovascular health? Are they avoiding going to the doctor? That might be a good place to start. I mean, what's concerning you most right now?
Here in the summer of 2021, we're still seeing that about 1 in 5 people are delaying healthcare visits. So they're delaying seeing their doctor, I think probably largely because of concerns about being exposed to the coronavirus. Now, that's better than it was a year ago when about 1 in 2 people were delaying healthcare visits, but it's still too many people. And we want to make sure that people get back in connection with their doctor, particularly if they have chronic conditions like high blood pressure, high cholesterol, or diabetes that put them at risk for heart disease and stroke. Those are things that really need to be managed with your doctor. And we have ways to make sure that you can get through the doctor's office safely without being exposed to the virus. So I would just really urge people to get back in touch with their primary care doctor or whoever's managing those chronic conditions to make sure they're going to be healthy in the long run.
Are you seeing any long haul symptoms based on people who've had COVID? Are you seeing any long haul symptoms that are affecting cardiovascular health?
Well, certainly in people who've had the COVID virus, we do see that there can be lingering symptoms in a significant proportion of them that can last sometimes for months. So those long haul symptoms are very important and they need to be managed. They need to be, followed, and you need to have a thorough checkup to make sure we understand just how the virus may have affected every organ system in the body, not just the lungs. And we know that there can be effects on the heart and the brain that can linger over time. So if people have persistent symptoms, it's very important for them to get in touch under management with their doctor to make sure we're doing everything we can to get them back to recovery as soon as possible.
If people have concerns about their cardiovascular health, if they're fighting heart disease or if they've had a stroke or anything like that, is there a reason that they should be concerned about getting the vaccine if they haven't been vaccinated yet? Could their body's reaction to the vaccine cause further complications?
So we would urge everyone who's eligible to get the vaccine. And of course, it's important to talk to your doctor to make sure that it's right for you. But particularly if you already have cardiovascular disease, if you've had a heart attack, if you've had a stroke, or if you have some of the really important conditions that put you at risk for severe COVID, like obesity, diabetes, high blood pressure, those people are in particular risk from this virus. So vaccination is especially important for people with those conditions because it will protect them from the severe complications. And there's no reason from any of the data that we've seen to suggest that side effects from the vaccine would be worse for those people. And the protection is clearly more important.
Are you concerned right now with the new Delta variant that might slow people down getting into the doctor?
Well, I think we should all be concerned about the Delta variant. It is just more infectious, more transmissible than the earlier variants of this virus. Now, the good news is that the vaccines protect us really, really well against this Delta variant. We are seeing a few breakthrough infections, but they're very uncommon. And so, again, everyone who is eligible for the vaccine should get it because it will protect you against the Delta variant. Even if you should get the Delta variant, the course of the illness will be much, much less severe. You're much less likely to be hospitalized or die if you have a pre-existing vaccination and you're exposed to Delta. So it is concerning, but I think we have protocols in place to protect people. And so if they can get to their doctor, not just for the vaccination, but also to manage their chronic conditions, it's incredibly important. We are open for business. We want to see people and we want to help people get back on track.
So something that we were even just talking about yesterday in our office, that so many of us have gained extra weight during the pandemic because we haven't been as physically active or because we've been working from home and you're just not walking around as much. What are some things that everyone should be doing to take care of their health or maybe address being more sedentary, the more sedentary lifestyles that we've had maybe over the last year?
Well, because of the pandemic, so many of us are in the same boat here. It affected our weight, no question. the COVID-19 is the 19 pounds that Americans gained on average during the pandemic, because we couldn't eat as healthily as we usually would be able to. We didn't have the opportunities to participate in physical activity, and we were more sedentary. So it's incredibly important that we sort of get back on track, especially during these warmer months when we can get outside and safely exercise. Get back to eating a more healthy a diet, and again, checking in with our doctors to make sure we know what our numbers are, we know what our targets are, and how we can get back to safer and healthier weights by pursuing some of those usual activities. So, there's no question that the pandemic has affected our physical health, but I would also stress that people pay attention to their mental health. It's been a really stressful time for everybody. So checking in with your doctor and making sure that they understand just what stresses you're experiencing as well, because those don't help your health conditions either.
Yeah, I was just going to ask actually the body-mind connection there with cardiovascular health in particular, I think is pretty strong. And are you seeing a rise in stressors, mental health stressors that would also impact people's heart health or increase the risk of something like stroke?
We are seeing significant rises in people reporting stress and mental health conditions. And I think for all the obvious reasons that we've been isolated, we haven't been able to really have those social pop-off valves that we really need for optimal mental health. So no question that any kind of stresses like that affect sleep, affect blood pressure, affect so many things, weight gain, so many things that can put us at risk for heart disease and stroke. And so, again, making a plan with your doctor about how to address that stress, how to hopefully mitigate it so that you can control those other things is really important. Stress drives so many other health conditions, and I think that we ignore it at our peril. So, I want to make sure that people get the message that in addition to addressing physical health with your doctor, do address your mental health and your stress levels as well.
What worries you most right now, or what haven't I asked you that you really want to get out there in terms of a message?
Well, I think the most important thing for people to hear about this message is that it is safe to get back to your doctor. It is really important to get back to your doctor so that you can know your numbers, know where you are, and again, make a plan for where you need to get to really optimize your health. And one of the most important things people can do to protect themselves and their loved ones, as well as their communities, is make sure that they're getting vaccinated against COVID. So, I would just urge everyone who's eligible, again, to make sure you're getting vaccinated. These vaccines are safe, they're incredibly effective, and they are our way out of this pandemic. I think, unfortunately, right now we're seeing that, more than 97% of the people who are hospitalized, more than 99% of the people who are dying currently from COVID are unvaccinated. That is the biggest risk factor at the moment for severe complications. So do that. And as we head into the fall and winter, get your annual flu vaccine as well. Flu will be back around this year, and I don't want anybody getting the flu either.